to Global Ovarian Cancer Chapter. By 2040, ovarian cancer will rise by 445,271, an increase of 42%. And if nothing changes, 4,143,040 women will be missing in our lives. They will be missing from the dinner table, from celebrations such as weddings, naming ceremonies, and even our festivals. This is the Lab Doctors channel. I will entreat you to subscribe to this channel, like, share, comment, and let's do this together. Let's get to know how ovarian cancer happens. Ovarian cancer starts from the ovaries, a small organ in the female reproductive system responsible for producing eggs for fertilization. Ovarian cancer begins when cells of your ovaries or nearby organs, such as fallopian tube, develop changes and mutations in their DNA makeup. Remember, DNA contains instructions that tells cells what to do. And so, when a DNA makeup changes or is mutated, wrong instructions can be given to cells. Changes that occurs in the DNA tells cells to multiply or grow abnormally, creating a tumor of cancer cells. Note that cancer cells continue to multiply and live while healthy cells die and is replaced by cancerous cells. Ovarian cancer has the ability to invade nearby tissues, spreading to other organs such as the fallopian tube, your intestine, your pancreas, and even your liver. So, this makes ovarian cancer and any cancer very serious. Who gets ovarian cancer? Ovarian cancer affects women and people assigned female at birth. This literally means that anyone with ovaries can develop ovarian cancer. Let's also not forget that ovarian cancer has no clear causes. However, scientists have identified things that increases a person's risk of developing ovarian cancer. So, this brings us to risk factors of ovarian cancer. Our first risk factor is old age. The risk of developing ovarian cancer increases as a person ages. Note that ovarian cancer are mostly diagnosed in older adults. Our next risk factor is inherited faulty or mutated genes. This is a gene a person inherits from his or her parent. The type of gene that increases a person's risk of developing ovarian cancer are BRCA1 and BRCA2. Remember, it also increases one's risk of developing breast cancer. Our next risk factor to consider is family history of ovarian cancer. If you have a relative that have developed or diagnosed of ovarian cancer, then you stand the chance of developing ovarian cancer. Our next point is obesity or overweight. If you are obese, you increase your risk of developing ovarian cancer. We also have postmenopausal hormone replacement therapy. Taking hormonal replacement therapy to control signs and symptoms of menopause increases your risk of developing ovarian cancer. Our next risk factor is endometriosis. This is a painful disorder in which a tissue similar to tissue lining the uterus of a person grows outside the uterus. Never having been pregnant before also increases your risk of developing ovarian cancer. Ovarian cancer can develop and spread throughout a person's abdomen before it causes signs, making it very difficult to detect in its early stages. So, in its advanced stages, these are some of the signs you may see: bloating and then indigestion. Digestion of food intake or food you take in your body becomes very difficult. Our next symptom is pelvic and abdominal pain. Fluid in your abdomen, the size of your abdomen increases. Our next symptom is feeling full quickly. Talking of frequent urination, weight loss, nausea, and abnormal vaginal discharge. Whilst these may be a common symptom a woman without cancer may have occasionally, ovarian cancer patients are reportedly to have these symptoms persistently and periodically. Moving on to how ovarian cancer is diagnosed, let's take note that despite years of research, experts have not yet come out with ovarian cancer screening tests yet. For this reason, this particular condition becomes very difficult to diagnose in its early stages. So, our first mode of diagnosing ovarian cancer is through pelvic examination. Our next mode of diagnosing ovarian cancer is through pelvic ultrasound. Here, your sonographer view or image your ovaries, fallopian tubes, and nearby organs to check out for enlarged or abnormal organs. Our next mode is through MRI, that is magnetic resonance imaging. We also use CT scan to diagnose ovarian cancer. Not forgetting a test called CA125. This is a test that is done to check out for cancer cells. Now, let's come to how ovarian cancer is managed or treated. Some goal of treating ovarian cancer is to remove as much, if not all, cancerous cells from the human body. And so our first mode is through surgery. This typically involves the removal of your ovaries or any other organs that has cancer in it. Our next point of treating ovarian cancer is through chemotherapy. These are drugs that are designed and target to kill cancer cells. We also have hormonal therapy and radiation. So these are means that ovarian cancer can be managed or treated. what can I do at all as a person or a woman to prevent ovarian cancer? Knowing your biological history and lowering your risks of developing ovarian cancer is the only way to help you minimize your risk factor. So I'll entreat you to subscribe to the Lab Doctors channel, like, share, comment, and let's do this together. Just as I always say, your health is very vital to me, to your family, and to the nation Ghana at large. So stay safe and then stay healthy till we meet again.